I'm Dr. Matt O'Donnell. I am a board-certified surgeon at Evolution Veterinary Specialists. So this is Griffin, who is an 8-year-old male neutered boxer mix who has a history of having mast cell tumors, and his owner recently noticed a new mass that had developed on the side of his head. And so that was diagnosed by our oncologist, Dr. Hawker, as a benign fatty tumor called a lipoma. But just for concerns that we may miss something diagnostically and the fact that the lipoma could get bigger, we decided it was a good idea to take it off. So what we did today is called a marginal excision or excisional biopsy, which is to just kind of take out what we can see and feel of the tumor as opposed to taking a lot of tissue around it. We're gonna submit that for biopsy for confirmation that it's a lipoma. Surgery, nice and routine, so hopefully he should heal up in about 2 weeks, and we should have the biopsy results to kind of allay any fears from the owner in about a week or so, and that should be the end of the story. I'd say in terms of these types of surgeries, it usually is a pretty routine thing unless we're trying to do a big resection where we're removing a lot of tissue and then creating a huge defect. This surgery itself, it was pretty close to the trigeminal nerve. Nerve runs kind of right across the face over the temporal muscle. So we did do some careful dissection around that, but otherwise I'd say pretty routine and pretty low risk.
Yeah, so we always take really good anesthesia notes, and we always document what medications we used, and then we always notate how they did during surgery and then how they wake up from anesthesia. And his procedure last time, he woke up just a little dysphoric, meaning they wake up and they're not really sure where they are. They kind of start swimming a little kind of unsure of things, and sometimes they like to almost flop around. So he woke up like that last time. So this time during his procedure, we gave him some different medications. I'm hoping he has a little bit smoother of a recovery, and I'm gonna sit here nice and close to him, so if he does wake up kind of rough, I'm here. Sometimes they like that contact, just like we do in humans, where if they feel that touch, they feel a little bit more secure and they're not so frightened when they wake up. So that's why usually when we recover, we try to stay nice and close to them. I'll usually keep a hand on them, let them know that they're okay, because it can be scary when waking up from anesthesia. They just don't know kind of what's going on, and it's not like we can talk to them and they understand. So we just try to make them as comfortable as possible waking up. So the tube is here. We anesthetize them, and if they go under a general anesthesia, we'll place the tube, and it helps us keep their airway nice and secure. And so he's breathing through this tube right now, and I'm gonna keep this in place until he's a little bit more alert. We usually like them to swallow at least twice. And when I see him swallow, I'm gonna leave it in place, wait for him to swallow again, and then if I feel like he's alert enough, then I can go ahead and pull that tube. We just don't want to pull it prematurely and then risk that airway not being secure if he runs into any issues.